Congratulations on starting your orthodontic treatment. Please listen carefully to the following instructions on how to care for braces and orthodontic appliances. During orthodontic treatment, it is very important to maintain excellent oral hygiene in order to keep the teeth and gums healthy. Patients should brush their teeth after each meal and snack. For children going to school and adults at work, it is very important to brush after lunch. Brushing twice a day is not enough. Allowing food to sit around your braces after lunch and then waiting until after dinner time to brush will be very unhealthy for your teeth. When you brush your teeth, we recommend a two-step brushing technique. Step 1. Brush and clean your braces and orthodontic appliances. Use your toothbrush without any toothpaste. Toothpaste foams up and can make it difficult to see plaque left on the braces. Focus on removing plaque, food, and buildup from around your braces. Pay special attention to removing plaque that is trapped between your braces and the gum line. Step 2 of toothbrushing. Brush normally with toothpaste, taking care to brush all surfaces of the teeth. Spend at least 2 to 3 minutes brushing. Now let's move on to flossing your teeth. We expect all of our patients to floss their teeth every day. And we recommend flossing in the evening after dinner time. Flossing with braces can be difficult and requires a special technique. A floss threader is used to place the floss under the wires between your teeth so that you can floss under the braces. Floss threaders are not single use, and each one can be used repeatedly until it frays or splits. Pull out a long piece of dental floss and feed it through the threader, folding the long floss in half. Slide the tip of the floss threader under the wire between the teeth. Grasp the end of the threader with your fingers, and after it is passed under the wire, pull the dental floss through the contact between your teeth. And floss out the food between your teeth. Then pull the floss out from under the wire. Repeat this process until the teeth are flossed. As you can see, flossing properly takes time and effort. We do expect our patients to floss every day. Realistically, you may not have time to floss your entire mouth each day. So our compromise is that our patients will alternate flossing the top and bottom teeth on a daily basis. Stick with it, even if you find flossing to be difficult in the beginning. Flossing becomes easier and easier over time. In rare cases, teeth can be so crowded that you are unable to floss between a couple of teeth. That's okay. As the teeth straighten out, you will be able to pull the floss between them. When you are flossing, avoid tugging too hard or pulling on the wires. This can lead to damaging your braces or cause braces to come off of your teeth. A proxy brush is also a useful way to clear away food that may become stuck between your teeth or under your braces. Gently place the brush under the wire and clean away food debris. At each orthodontic appointment, we check your brushing and flossing, and we assign a letter grade. Just like in school, we want everyone to earn an A. If you have food on your teeth, brush your teeth at our toothbrush station before sitting down in the dental chair to be seen by the doctor. If you do not, your hygiene grade will automatically be lower, and we may get behind schedule because we will ask you to go back out to the toothbrushing station. If a patient is not brushing well or not flossing well, we will review the trouble spots and give you advice on how to improve. When necessary, we will also include parents so that they can help keep things on track at home. From time to time, the doctor may also recommend a daily fluoride mouthwash or a daily antibacterial mouth rinse. Check with the doctor if you screw this up. From time to time, the doctor may also recommend a daily fluoride mouthwash or a daily antibacterial mouth rinse. Check with the doctor if you have any questions about mouthwash. We highly recommend the use of Xylitol Chewing Gum. Xylitol gum is sugar-free, and the bacteria that cause tooth decay are inhibited by xylitol. We recommend chewing 2 cubes of Hershey's Icebreakers Ice Cubes gum each day, preferably for 30 minutes after lunch and especially after dinner. Excessive gum chewing throughout the day is not advised. However, Xylitol Chewing Gum dramatically reduces the number of bacteria found in your mouth and helps protect teeth and gums. More and more gums do contain xylitol. However, the dosage tends to be small. Ice cubes contain 1 gram of xylitol per cube, which is just right. There are consequences for patients who choose not to follow the rules of brushing and flossing during orthodontic treatment. When plaque is left on the teeth, especially around the braces, bacterial growth will set in. Colonies of bacteria will eat the plaque, and the bacteria produces waste material, which is very acidic. This will slowly demineralize and weaken your teeth, leading to permanent chalky white spots or cavities that will need to be fixed by your family dentist. The more sugary foods you have in your diet, the worse this may become. Also, your gums may become infected with bacteria, resulting in a gum disease called gingivitis. In the event your mouth becomes unhealthy, your orthodontist may require seeing the family dentist for extra dental cleanings, fluoride varnish treatments, or prescription toothpaste to help repair tooth enamel, removal of the wires from your braces for 2 to 3 weeks so that you can brush and floss without anything in your way, which may extend your time in braces by 2 to 3 months because the teeth will begin to move back, removing braces altogether and stopping treatment. A healthy mouth is a happy mouth. And remember, it's very important to see your family dentist every 6 months during orthodontic treatment for a dental exam and a dental cleaning. Please listen carefully to the following instructions on how to minimize discomfort during orthodontic treatment. During orthodontic treatment, patients will sometimes feel discomfort. Discomfort of the lips, cheeks, and sometimes the tongue is to be expected at the beginning of orthodontic treatment. After the braces are on, your lips and cheeks are no longer resting against the smooth surfaces of your teeth. Usually it takes about a month for your lips and cheeks to toughen up and get used to braces or appliances. Until then, you may be a little sore. Occasionally, a small sore or ulcer may form. If this happens, apply some orthodontic numbing medicine on the sore spot. You may also place a small amount of orthodontic wax over the braces in the area that is bothering you. Only use the wax if you really need it. If you use the wax early and often, the wax will become a crutch, and your teeth will move more slowly with wax gunked all around them. Warm saltwater swishes may also help soothe the sore area and help heal it more quickly. As the teeth begin to move, patients will feel some soreness around the teeth, especially the front teeth if they are crowded. This soreness will likely start about 12 to 24 hours after braces go on and will likely last for 4 to 5 days. The following medications, provided the patient is not allergic, work very well to minimize soreness. Generic ibuprofen, which is equivalent to Advil or Motrin, may be taken 2 to 3 times daily. Generic naproxen, which is equivalent to Aleve, may be taken up to 2 to 3 times daily. Acetaminophen, or Tylenol, may also be used, but is not quite as effective as the ibuprofen or naproxen. The doctor will answer any questions you may have about the proper dosage and when to take the medicine throughout the day. We recommend taking your medicine for the first 4 to 5 days, starting with the day you get your braces or appliances on. Remember, you may not be sore right now, but you probably will be before tomorrow. Follow this helpful advice, and you will be much more comfortable. You may notice the soreness most when you are eating a meal, and the front teeth may be especially sensitive. Here's a helpful tip. Chew a piece of sugarless gum for about 30 minutes prior to sitting down to eat. You should use the teeth that are the most sore to chew the gum. This will help work out some of the soreness, and you will be more comfortable when you eat. Note that frequent or extended periods of gum chewing are not advised, as this will put orthodontic appliances through a lot of wear and tear. We recommend Xylitol chewing gum, such as Hershey's Icebreakers ice cubes. After you start treatment, the orthodontist will see you for an adjustment appointment about every 4 to 8 weeks, depending on your type of treatment. You may notice after adjustment appointments, your braces will feel tight for several hours. This tightness is usually followed by a period of a few days when your teeth may feel sore. Believe it or not, it's actually a good idea to chew gum immediately after an appointment, or whenever your wires feel especially tight. Chewing will result in an increase in blood circulation around the roots of the teeth. This helps to clear out the biochemicals that are associated with soreness. Keep the gum chewing period to a minimum, and by all means, chew only sugarless gum. We have already reviewed taking medications to minimize soreness. Medications may be taken before or directly following an adjustment appointment to help reduce soreness. Please listen carefully to the following instructions about dietary restrictions during orthodontic treatment. When it comes to eating, there are two important factors: what you eat and how you eat. Both are equally important. Your diet directly affects the health of the supporting gum tissues and bone around your teeth. If you are careful about the type of food you select and the way you eat your food, your teeth and gums will stay healthy throughout treatment, and your orthodontic appliances will remain in good working condition. The braces on your front teeth are bonded to the surfaces of your teeth. These braces may shear off when biting into hard food. In general, try not to bite into any food with your front teeth. Cut up your food into small bite-sized pieces or tear all food into small pieces. Take care to chew your food slowly and carefully with your back teeth. So the bottom line on how you eat is this: cut everything up into small pieces and chew slowly with the back teeth. Hard and crunchy foods. Unfortunately, a lot of what we normally think of as healthy food is very hard on braces. Since it is very important to maintain a healthy diet, fresh fruits and vegetables that are hard and crunchy should either be cut into small bite-sized pieces or cooked until tender. When eating meat, always cut it off the bone. Sticky and chewy foods. Any food that sticks to the teeth or that may get stuck around your braces or appliances should be avoided. These types of foods usually have high sugar content as well. Sugary foods that have become lodged between the teeth and the braces will increase the risk of cavity formation or tooth decay. Most patients also have braces bonded on the back teeth. Some patients have bands on the back teeth, and these bands go all the way around each tooth. These bands are more resistant to breaking than the braces on the front teeth. However, sticky foods may pull at the bands and eventually break the cement seal. Once the cement seal is broken, plaque begins to leak in and may cause tooth decay. Take a moment to look over some examples of food to avoid. You might call this the common sense list. We cannot possibly list every type of food to avoid. If you want to eat something that is similar to the foods on this list, common sense would tell you you probably should avoid eating it. Sugary drinks. There are several types of sugary drinks you should avoid altogether during orthodontic treatment. Sugary drinks will lead to decalcification marks and possibly tooth decay. Examples are most sports drinks. They typically have sugar and are less healthy than the commercials would have you believe. Energy drinks, which are typically very high in sugar and have unhealthy levels of caffeine as well. Sodas of any kind, even diet soda. Diet soda is even more acidic than regular soda and damages tooth enamel. And in the South, this is a tough one, but we also ask that you avoid sweet tea. We strive to provide excellent results for our patients and to finish treatment on time. Following the guidelines we have discussed is a very important part of your treatment. Patients who are rough on their braces and appliances will make it more difficult for the doctor to achieve the desired results. Loose appliances or broken appliances prolong orthodontic treatment. If the teeth are not attached properly to the wires, they are not under control and may move in the wrong direction. Patients who avoid eating the foods we have discussed may still cause something to come loose. This is almost always because the patient is not cutting food up into small pieces and chewing slowly and carefully. In an average week, a patient will go through several thousand chewing cycles. Being a little too rough will eventually lead to the straw that breaks the camel's back, and something will come loose. Patients should also avoid chewing on things like pencils, pens, and fingernails, as this may damage your braces. And for our younger patients, respect your parents' time and money. They may need to bring you for extra visits if you are not following the rules. They may have to take extra time off from work or other activities, and the gas they put in their cars is not free. Please listen carefully to the following instructions on what to do if something breaks on your braces, or what to do if your braces are poking you and you need to schedule a comfort repair or a repair for broken braces. Occasionally, accidents happen and something will come loose during treatment. For children and teenagers, make sure you immediately tell your parents if something ever comes loose or breaks. Contact us so that we may advise you on when to visit the office for a repair. When a patient arrives for an adjustment and surprises us with loose or broken appliances, we may not have time in our schedule to both repair and adjust the braces. Letting us know in advance is the best way to keep treatment moving forward on time. If part of your braces slides off the wire into your mouth, carefully retrieve it and save it in a plastic bag. The braces are very expensive to replace. Bring it with you to your next orthodontic appointment so that we can reapply it to your tooth. Occasionally, a wire might poke the lips, gums, or cheeks. Applying some orthodontic wax is a good solution. You may also apply some orthodontic numbing medicine on the sore spot. Sometimes you will be able to slide the wire back around into the proper position yourself, but be gentle. Please contact us so that we may quickly schedule a comfort repair during regular business hours. If something happens on the weekend, please leave us a message at the office so that we may schedule a comfort repair early in the business week. True orthodontic emergencies are very rare. Typically, braces that have come loose or wires that are poking are not considered emergencies and are not repaired on weekends. In the event of a true emergency, dial 911 on your telephone and seek immediate medical assistance. An orthodontist is available by phone after business hours for extraordinary situations. Call the office and you will be prompted with instructions to reach the doctor. Patients and parents often ask about sports mouth guards. Patients who participate in sports during orthodontic treatment should wear protective sports mouth guards. Thank you for listening. We welcome any questions that you may have.